Hello guys, I hope you are doing good. In this video, we are continuing our series of Krok 1 General Medicine Explanation, and we are doing the next 25 questions. Here the patient is having chest pain, and her doctor suspected myeloma or plasmacytoma. This is a cancer that its diagnostic criteria is based on the presence of paraproteins in blood. So paraproteins also have the name of Benz-Jones proteins, and this is because, as you can remember, the plasma cells are fully differentiated B lymphocytes that differentiate into plasma cells, and they give us antibodies. So the paraproteinemia is a finding of high concentration of immunoglobulins in blood, or also immunoglobulins, mainly the M components. Next question. So the sportsman jumped and landed on the outside edge of his foot. So this is a trauma. And the trauma led to a swelling, and the skin became red and warm. So this, you can guess, is a arterial hyperemia, and it can be explained by the increased inflow of oxygenated blood within the vessels after trauma, and it gives this pattern of bright red color, which is just like an appearance of the high oxygenated blood. But when we have a decreased outflow, like we have a normal inflow of arterial blood, but we're having a congestion here of the venous blood, we can have a bluish pattern. So here we took a smear from the pharynx, and from a pharynx of a suspect of diphtheria, and we revealed volatile granules. I want to show you here volatile granules. Here are the volatile granules in different staining. And the etiologic drug that we should use for diphtheria, against diphtheria, is anti-diphtheric antitoxin serum. This serum is made from the blood of horses. So they inject the diphtheria-causing bacteria to the horses, and then they collect the blood from the horses and separate the antitoxin-rich serum from the bacteria, and they purify the antitoxin to give it as a medicine. The anatoxin here, I don't want you to choose it because this is for vaccination. So anatoxin is a vaccine that does not serve us for treatment because the person is already sick. Here the patient had an operation. So it was an excision of gallbladder, means removing of gallbladder, and this affected the calcium absorption from the bowels wall. So the gallbladder plays an important or a main role in the absorption of calcium and minerals, and this function can be impaired by the stone or after the excision of gallbladder, so we should help with some supplements. As you can see here, the sunlight is also a source of the D3 vitamin that goes to the liver and the kidney, and the main place for absorption is intestines. So since the gallbladder here is exist, then we should give supplements as D3 vitamin to help the calcium get absorbed in the intestines. Here the woman had extrauterine pregnancy. It's tubal. That means in the fallopian tube. The fallopian tube here, well, let's talk about a normal pregnancy. A normal pregnancy is in the uterus, and it's implanted to the endometrium of the uterus cavity. But when we have extrauterine cavity, it can be anywhere. It can be cervical, in the cervix, interstitial, it can be in the peritoneum, it can be in the isthmus of the fallopian tube, the ampulla, in the infundibulum, or even in the ovary itself, or abdominal. But here in this case, we're having a tubal, means here in the fallopian tube. And in order to stop a bleeding or to prevent a bleeding, you can see here the ovarian artery supplies not only the ovary but also the fallopian tube, and also the uterine artery, so it supplies the uterus and also the fallopian tube, as you can see here. So it's the fallopian tube is found between these two arteries. That's why the surgeon should ligate them to prevent any hemorrhage. This is a 6-month-old baby. He's 1/2 year old. He was ill with bronchitis and did an x-ray of chest. So the x-ray showed a shadow of the thymus gland. This shadow is actually abnormal, like it's not seen in the adults. But for this age, 6-month-year-old, is a completely normal pattern, is completely normal if you see it on the ECG, and it's also called cell-shaped thymus. The next question. Here the patient is having diarrheas after consumption of rich food. See, here rich food is mainly because of lipid consumption. And the examination revealed steatorrhea. If you remember from our last video, I explained steatorrhea in the first question. It was a condition where there are lipids, or the presence of undigested lipids in the stool or in the feces. The feces were hypocolic, and you can think of jaundice when you see steatorrhea, and the change of color of feces. The hypocolic or acolic is the same, actually, because the normal color of feces should be dark. But if we're having a pale color of feces, that means we're having a post-hepatic type of jaundice, and this is because of the obturation of biliary tracts. As you can remember, this is the gallbladder. From the liver, we have two ducts, the right and left. They merge together to give us the common hepatic duct. Then the cystic duct from the gallbladder merges within the common hepatic duct to give us the choledicus duct here. So this is where it ends the hepatic tract. That means whatever happens after the hepatic duct, it will be post-hepatic, because it happened after the hepatic anatomical features. In this question, the patient was having skin lesions, and we isolated from his blood some colonies that was surrounded by hemolysis zones. This is the hemolysis zones here. This is the bacteria, the colony of bacteria, and the colonies were gram-positive. The colonies were gram-positive, and they are oxidase and catalase positive. And also, they synthesize plasmacoagulase. This is another enzyme. These 2 or 3 patterns are specific for Staphylococcus aureus. As you can see here, it is a catalase positive and a coagulase and also oxidase positive bacteria. So you can differentiate it from others with the enzyme. This patient is having gout, so you always should link gout with uric acid. And also, he was having some renal calculi. The renal calculi are formed because these uric acid crystals will gather and form as stones that look like this in the kidneys. Also, you can see the uric acid stones are very often found in the gout patients. Here we had a patient that we took a scrape from his tongue, and the scrape microscopically revealed oval, round, and elongated chains of dark violet germinating cells. Here are the microscopic smear or slide of candidoses. So these are round oval fungi that form elongated chains. As you can see here, it goes like in a chain pattern, and it's dark violet, as you can see in the microscopic scrape. Here the patient is complaining of body weight, and objectively when you see, there is a moon face. As you can see, it's like a moon. It's round, and the hirsutism means outgrowth of hair in the unusual places where hair normally grows for women. It can happen also in men. So, and also the accumulation of lipids on her neck is called the buffalo hump. This is because of the Cushing syndrome. You can think, when you see the question at the first time, you can think that the body weight and the obesity is coming from maybe reduced production of thyroid hormones, means decreased metabolism, or because of increased insulin production. This is as a consequence from insulin resistance. And also, you will be right if you choose glucocorticoids, because it's a Cushing syndrome. That means the corticosteroids are being secreted in a high level within blood. So you can see here the stretch marks in the belly, in the abdomen, the fat pads, and also the moon face and hirsutism are markers of Cushing syndrome, objectively. The next question. The patient was having sepsis. Sepsis, this is a pathological blood problem caused by bacteria in the blood. And in the sugar broth, we inoculated some bacteria and from the blood, and we saw that in the blood, agar showed some small transparent round colonies surrounded with hemolysis zone. These bacteria are gram-positive cocci in a form of elongated chains. So this is the pattern that should help you differentiate between streptococci and staphylococci, as you can see here in the picture, the streptococci form chains, while staphylococci are in like a grape shape. So the patient underwent resection of the pyloric part of stomach. I will talk about this detail right after I explain the blood values. See here we have in the hemoglobin. This is a low level of hemoglobin. The erythrocytes level is average. The color index is lower than the value that fluctuates between 0.8 to 1, and this will help you to think about the microcytic anemia because of the iron deficiency. You can see here some microcytes, and this is a normal RBC. As you can see the difference of the color index on the microscopic smear. What I want you to pay attention to is not to be misled by the pyloric part of stomach, because it has nothing to do with the megalocytes. This one. And the megalocytes can be in the case where the intrinsic factor is not produced from the parietal cells that are present in the cardia and fundus. But here in this question, the pyloric part is being resected, so that means it has nothing to do with the megalocytes or the pernicious anemia, where the vitamin B12 is not absorbed. In this question, the patient is having hepatocirrhosis, and we want to estimate the antitoxic liver function. So this is done by the, let me show you here, the test is done when we have benzoic acid injection to the subject, and we can see that the liver conjugates benzoic acid to form the hippuric acid, and we can see it in the urine. So the hepatocirrhosis, in the case of hepatocirrhosis, we will have like low level of hippuric acid in the urine. In the territory of an old ground, we found some 50-year-old bacteria that has viable spores and can cause a very dangerous disease. So these bacteria in the soil that can be in a long period of time present and alive is the Bacillus anthracis, and the spores help the bacteria to survive when there is lack of nutrients and heat or lack of metabolic activity. And also these bacteria here also are spore forming. But I want you to remember this particular detail, that the anthracis or Bacillus anthracis is will compete all of them, even if they are present, but Bacillus anthracis will incubate these bacteria so that they will transform to a Bacillus anthracis agent. So whatever bacteria will be on the ground, the Bacillus anthracis will compete it. So during autopsy of a man working as a miner, he had cardiopulmonary decompensation, and in the resection of lung surface, we had a grayish-black appearance. Here is a cutting surface of the lung, how it appears. It's a grayish-black pattern. So this is anthracosis, and it's because of the, I don't want you to confuse it with the anthrax or the Bacillus anthracis. It has nothing to do. The etiology of this disease is different from the previous one, and this is not a bacterial etiology. This is not a bacterial disease. So in anthracosis, we have accumulation of coal dust in the lung tissue. Here we used the stain Ziehl-Neelsen to reveal the red bacilli of tuberculous bacillus. And we need this test to identify the acid resistance bacteria. The acid resistance bacteria have heavy chains of waxes and lipids that prevent this mycotic acid layer to be stained. So you can see here we applied the primary stain, then the mordant, and then during the decolorization, the acid-fast bacteria here did not wash out. They were not neutralized. Means the waxy layer protects them from getting stained. And we used the methylene blue here to stain the non-acid-fast bacteria with blue and to let us differentiate between the acid-fast bacteria that do not lose their stain from the non-acid-fast that can stain very easily because of the lack of the waxy layer. Here, a 10-year-old boy consulted the doctor about extension of hair in beard and mustache. This is a 10-year-old boy, and he also had low voice. And of course, you can definitely think of testosterone because this is the main hormone that found in males that help them to grow hair than females and have low voice. But this boy is having a hormonal problem, which is not normal. Now we have an atherosclerotic plaque present in the coronary arteries, and it was closed in the lumen. So we had, as a consequence, multiple whitish layers of connective tissue. Of course, this multiple will help you remember that it's diffusive. Let me show you what an atherosclerotic plaque looks like. Here there is the normal blood flow. Here is when the ischemic heart disease will happen because of the the amount of oxygenated blood is not flowing properly to the blood. But here there is the atherosclerotic plaque that will block completely the lumen of the vessel and will give us an infarction, which lead to necrosis. So, but here we're having multiple whitish layers of connective tissue. So the layers of connective tissue are of these are hardened collagen fibers that accumulate in the heart tissue because of the lack of blood flow. This is an ischemic heart disease. So you can differentiate between these two with the whitish layers, because in the post-infarction, we will have an infarction, means necrosis, and not whitish appearance. It will be of dark appearance. Also, the tiger's heart will be of dark appearance. The myocarditis is an inflammatory disease, and the myocardial infarction is almost like the post-infarction case. Now we are discussing the HIV virus, which has the notorious enzyme reverse transcriptase that forms DNA from mRNA. You can see here the normal sequence of transcription is from DNA to RNA, but the reverse transcriptase does the reverse work, which is from RNA to DNA. This is one of the main points of its pathogenicity. The man had trauma on his left hand, and he had the wound caused him he had the wound here, and the cutting was on this level, so it led to the absence or the inability to flex or to bend the phalanges, the second, third, fourth, and the fifth. So you can see here that the flexor, the superficial digitoral flexor, helps to bend or to flex these phalanges. I think you will not be confused. In this histological examination, we revealed some granulomas consisting of microphagal nodules with lymphocytes and plasmatic cells. So these vacuoles contained some Virchow cells, and this disease is called lepra or leprosy. And I can show you here some pictures of this disease. But what I want you to know and to understand here is the granulomas. What is a granuloma? Granuloma is this type of it's an accumulation of macrophages and plasmatic cells because the immune system could not fight or could not really get rid of the pathogenic problem or the bacteria that caused this disease, and the immune system led to the isolation of these macrophages, bacteria, and plasmatic cells, and they were impacted in some granules that appear here. Like you can see here, foamy histocytes, macrophages, many macrophages that are trying still to kill the pathogenic factor. We wanted to estimate the toxicity of diphtheria, and we inoculated on petri dish on a nutrient agar some like the diphtheria bacteria on either side of the filter paper strip, and we moistened this paper strip with anti-diphtheric antitoxic serum. We incubated it. Like after incubation and of these inoculations, we found some areas of medium turbidity. Here is a picture showing this precipitation reaction or precipitation gel reaction. You can see here the lines that showed on the edges of the strip. And this is because of the reaction between the diphtheric antitoxin and the exotoxins. The patient was taking clonidine for essential hypertension treatment, and he was using alcohol. So we have clonidine and alcohol, but alcohol caused intense inhibition of central nervous system. He should just be drunk and not, like, the alcohol should not really cause him an intense inhibition of the central nervous system. This is because of the effect potentiation between these two drugs. I want you to know that this is a type of synergism. So potentiation is a type of synergism, and also summation is a type of synergism. But the difference between these two is when there is a summation, there is just the effect of the first drug plus the effect of single drug that is algebraically does not increase. It just gives the sum of the both effects. But in potentiation, we get the result as the higher effect of even these drugs used singularly. Means if we use clonidine plus alcohol, we're getting more than the algebraic sum. Here we are taking an ovary specimen and we stain it with hematoxylin aerosane, and we revealed a follicle consisting of 1 to 2 layers of cubic cells. This is our primary follicle that will later give us an ovocyte. And I want to show you here different appearance of the primary follicle. You can see here the cubic cells here in the with the blue color. As you can see here, the cubic cells are like forming a flower. Here in a histological specimen, the cubic cells, so it's just one layer. In the secondary follicle, already the theca cells are formed, so they will mention the theca cells if ever they're asking about secondary follicle. Also in the tertiary follicle, we have antrum because of the margination of the oocytes and the nucleus towards the granulosa cells, and we have an antrum. So for just one single layer or two, the primary follicle is the correct variant. So this is it, guys. I hope we made you understand the reason behind you memorize such answers even without knowing the explanation. I invite Arabic speaking students to check our Arabic Krok 1 explanation. It will be very beneficial for you. This is explained in a different way, and the other videos will definitely contain more info for you. So see you in the next 25 questions.